Alors, bonjour à tous et bienvenue.
Good afternoon, everybody, and welcome to this press conference with Premier François Legault, who's accompanied today with Health Minister Christian Dubé, as well as the National Health Director, Mr. Horacio Arruda. Mr. Legault, the floor is yours. Hello, everybody. Listen, today I want to talk to all Quebecers from all regions, from all generations. You have seen over the past few weeks a number of cases has increased in several regions of Quebec. We now have 8 regions that went to the yellow alert level, so the pre-alert level. So we've got Montreal, Quebec, Laval, Monteregie, Estrie, Outaouais, Chaudiere-Appalaches, and Lower St. Lawrence. So 8 regions, and obviously this is a lot. So it's not just concentrated in a few big cities. We can see that currently the transmission of the virus is really happening in the community. And when I say community, it's establishments as well as private homes. So we see, over the past few weeks, we've seen that following family gatherings or gatherings amongst friends, the virus is being transmitted too much. And I'm very worried about the situation that we are currently experiencing and the trend that we are seeing in Quebec. If the virus continues to spread at that pace, well, we may actually have some people who will find themselves in hospital, and even some people who eventually may die. We may also overload the hospitals and find ourselves with people who will have their surgery delayed. We are starting to see some cases in several classrooms in some of our schools, so we have had to close some classrooms. Even if it's less than 1% of the population, if it continues, there will be more and more children who won't be able to go to school. And that's the worst thing imaginable. And if the virus continues to spread, there is also a risk that we may eventually have to shut down some businesses. So there are some mothers and fathers who may lose their jobs. The situation is critical, it's worrisome, and we must react now. It is every Quebecer's responsibility. And today, I want to call upon the solidarity of Quebecers. I want to ask all men, women, young people, the elderly in Quebec, please think about the vulnerable people. Think about those who are waiting for a surgery. Think about those who are working in our healthcare network. Think about our children. Think about the men and women who need these revenues to support their family. So it's now time to think about other people. I'm asking everybody to limit as much as possible the gatherings, including in private homes. Now is not the time to have family parties or parties amongst friends. You can gather, a few of you. A few people can gather together, but please be prudent. Respect physical distancing, wear a mask. And I understand that it's not easy. I understand that we've been doing this for more than 6 months. There are some people, myself included, who can't wait for us to go back to a normal life, but the virus is still present. And it's not just in Quebec. You can see throughout the world, there are a lot of countries where there's a strong increase in the number of cases. So this is not specific to Quebec. We are all at war against this virus. And there is a true risk of a second wave. So there's a true risk that there may be a pretty strong wave which will lead us to start confining Quebecers once again. We don't want that. So I will close by telling you, I'm counting on Quebecers, I'm counting on all of you. I need your help. Please think about others. Please wear a mask. Respect physical distancing. We are able together to get through this and to see our number of cases decrease once again, but we must act now. I'm counting on you, and I thank you in advance.
A few words in English. Hello, everyone. Today I have a message for all Quebecers of all generations and all regions. In recent weeks, the virus has been spreading throughout Quebec. The number of positive cases is growing every week. The problem we have is mainly community transmission between friends and families. I'm very worried of what's happening. If the virus continues to spread, people will be hospitalized, some people will die. I'm worried also for people who need to be treated. I'm worried for our children. We cannot close our schools. Our children need it. I'm also worried for our businesses, for our workers. So the situation is worrying, and we must act now. Everyone has a responsibility to do so. I'm sending a call for solidarity to all Quebecers, young or old. Think about our vulnerable people. Think about our children. Think about the consequences of letting your guard down. So I'm asking people to avoid gatherings as much as possible. Try to avoid contacts as much as possible. So we have to react together now. Thank you. Maintenant, je passe la parole au...
And now I will ask the Health Minister to speak to you. Thank you, Mr. Premier. I would like to illustrate in greater detail some of the Premier's comments. First of all, I was asked often over the past few weeks, why are we worried even if there's an increase in cases? And you can see quite well over the past few days. This morning we had close to 300 cases that were reported for yesterday. And people are wondering, why are you so worried for cases when we don't see either an increase in hospitalizations or additional deaths? And I would tell you that over the past few days, you have seen, for those of you who follow this closely, there was an increase in the hospitalizations. But what's even more important is the impact that it has on our healthcare network. And I'll give you some examples today. So not respecting the rules has an impact on people who may get the illness or pass it on to others. But right now, we've got a healthcare system that is very fragile. And when we have to make choices that are very difficult to make, and we've begun making them, unfortunately, in certain regions, and we'll talk about the region of Quebec, where we must, for example, take some staff that was providing care and ask them to come help us in screening. Well, already these are choices that we're making. And perhaps you'll remember what I was explaining at the beginning of the week. Perhaps that people don't necessarily see this. People who say that it's not important and we don't really see it in your stats, I'm going to tell you that we do see it and we feel it in our healthcare system. And unfortunately, we can't wait until we see it even more before we react. So that's what I wanted to communicate to you today. And that is why we will announce some additional measures today, because we cannot continue to put at risk our healthcare system. I also want to remind you what our criteria are, because now we just had 4 zones that went to the yellow level. And for me, it's important that people understand this because, and I'll answer your questions with Dr. Horacio Arruda, but for me, the reasons that put these 4 regions at the yellow level, well, obviously, we're talking about community transmission. The Premier mentioned this. But what does community transmission mean exactly? People are forgetting this. It's our loved ones, our families. And it's not an individual that comes from Europe. When we let our guard down with our friends and our family members, people who come to visit us, and that is why We put so much emphasis on private parties. Private parties are our biggest problem. It's when people gather together, and then unfortunately, after having a couple of drinks, well, we let down our guard, and then we get closer. We're not wearing a mask, and then somebody leaves that private party, and they go spread the illness not to one person or two, but to 10 people, because these people travel about. So the community transmission today is a main reason why there are 4 of our regions that we've put in the yellow zone. I talked to you about the number of outbreaks. I told you that there's a number of outbreaks, but there's also the size of the outbreaks. I will give you some examples later, particularly in these regions, so that people can well understand why these regions are now at the yellow level. I explained earlier that the capacity, you remember I had explained that there were 3 criteria, right? But the capacity to provide care in those regions is just as important, and you can feel it. For those of you who are in the Quebec region, you hear about it. We've already got some issues when it comes to capacity in Quebec for the reasons that, because we've got these outbreaks. And I would finish with gatherings, private gatherings, and I would tell you as well, parties and bars, and I will give you some examples of events that occurred and that are truly outside of the standards, and that is why we are worried for these regions. I mentioned 4 new regions. I will give you examples so that people can identify themselves. In the Monteregie, there was a gathering of 17 people in a restaurant, 17 people together. And because of this gathering, there are 31 cases currently that are associated to this gathering. But do you know, we will have to screen 330 clients who registered on that restaurant's log. Now imagine the workload for the people in public health to contact all of these people. And unfortunately, there are some people who don't even answer the calls. They don't want to answer the calls. So imagine the difficulty that we've got now. It's not only contacting these 330 people, but having the right answer so that we can stop the outbreak, so that we can control the outbreak. There was a picnic. I'm still in the Monteregie. There was a picnic, a barbecue outside at Mont-Saint-Bruno without any physical distancing measures, no masks. There are at least 5 cases that came from that. And these 5 cases, that's 5 cases before we take into consideration the contagion. And that is unacceptable to me. If people don't understand these types of examples, well, I'm sorry, but they will never understand. Chaudiere-Appalaches. Somebody brought that up in the reporters group, and we've got it on our radar. We've had it on our radar for a few days. There was a hairdresser who knew that she was contagious. She served 15 clients in 6 different salons, in an RPA, in a CHSLD, and in a residence. That's unacceptable. In Montreal, in life environments, and here I've got a correlation with the people who did not follow the rules. Currently, I've got 27 new cases in establishments, either in an RPA. And for me, what I'm concerned about, and you will see the measures that we will announce later for the RPAs, we've been working very hard over the past 3 to 4 months in the CHSLDs, but the RPAs, for me, that's our next problem if we're not careful. So I'll give you these examples. We've got at least 20 cases, new cases, in RPA establishments. I will finish with the Lower St. Lawrence. The Lower St. Lawrence, as you know, is a 4th region that is going to yellow. There were some private parties, all the right excuses, right? They had several parties, and there are many positive cases that came out of these parties. And now what I'm hearing is that people are playing with the rules because we put maximum limits in place, and now Dr. Arruda will explain this to you. But now we're starting to create little groups, and we say, well, it's 3, 4 little groups. It doesn't count. Well, listen, it's the same gathering, and these people gather after. So I think in the case of the Lower St. Lawrence, we had more than 30 cases just over the past 48 hours because of this corn roast. Now, what does that mean for these regions to be in a yellow zone? Well, the early warning for me, and you've seen this in Quebec over the past few days because Quebec has been in the yellow since last week. There will be more police interventions, that's for sure. There already have been some, and there will be even more. There will be more inspections. We will do targeted screening. You saw what was our average over the past few days. We are between 20 and 26,000 tests, so we'll be able to do targeted screening. We have to do this. We will announce now. We're going to announce it now, actually. We will prohibit the sale of food at midnight, after midnight in bars. The reason is that because people think that they're more intelligent than the rules and the public health, and they say, well, it's easy. If we want to continue to sell alcohol, well, we just have to add, chicken nuggets, and that'll be okay. But that's not how it works. This is done. No more food after midnight in bars. We will control the traffic in certain environments so as to facilitate things. So the 8 zones that have just gone to yellow, unfortunately, mainly because of individuals who are irresponsible, and this will have an impact on 75% of Quebec. The 8 zones that are now in yellow represent 75% of the population in Quebec. Now, what comes after yellow? You'll remember it's the orange zone. And what does that mean if we go to the orange zone? Well, we will have to reduce the number of people in public events, particularly what we call non-organized gatherings like weddings or these types of events. We will reduce the number of people in private homes. If we go into the orange zone, it will go from 10 to 6. There will be the closing of bars. There would be some restrictions in restaurants, and they would be limited to takeout. I'm reminding you that there are none of the 8 regions that are in the orange zone now, but a few of them are very close to being in the orange zone. And if these regions, unfortunately, and I'm repeating myself, if because of irresponsible individuals, we have to go to the orange zone, we will have restrictive measures like the ones that I have just mentioned. I will finish with measures that are particularly important for our elderly. There are already some rules that are effective in our RPAs. We're very concerned about the RPAs. Currently, the rules, when people go visit people, family members at the RPA, the wearing of the mask is required for visitors and for staff. Most of the RPAs have a log for people who come in and out, and that log is not particularly to restrict the entry and exit of the residents, but to be able to see if there were some cases, to be able to do some screening. It's about the same principle as we had with the restaurants and bars. Now, what we will add to this rule, which is very important, and which is aligned with what's already been done in condos or apartment buildings, is we will ask residents in these RPAs to wear the mask when they walk around in the hallways, because we realized that this could be an element that is very important. We had already seen this in condos, so what we will ask is that in the hallways, in the elevators, in the common rooms, people who are residents of RPAs will have to wear the mask. And I know you've already heard me. I know that it's a drag. These are restrictions that are not fun to announce. We don't like to do so, but I'm repeating it for the reasons that I've explained. We must go on with a mask wearing. I would like to remind you of what the Premier has said. If we want to keep a minimum of normality, of normalcy, these solutions are in our hands. There's nothing magical in what we've just announced. I think that being responsible, acting responsibly, means that we think about others. But I'm repeating myself here. Our healthcare system is already fragile. And every time that we have a new case and that we have to work with public health, or that this person can one day go to a clinic or go to the hospital, this is staff, healthcare staff that we are using, whereas we could have avoided this. So I'm asking you to be responsible, and I appreciate all the efforts that you will deploy over the next few days. Thank you very much. I would like to say something, if you'll allow me. First of all, I would like to tell you that as a National Health Director, like the Premier and the Minister, I am worried by what I'm seeing now. I understand that some people want to loosen the rules. We're a little bit fatigued, and people perhaps are a little bit, they're not as worried about the situation because they think that the virus has disappeared, but this virus is still here. We have to collaborate with the public health teams. If you are contacted and if you have a positive test, you can't roam around. Perhaps for you, perhaps you won't be sick, but it may be your grandmother or the grandmother of a friend who will die because of this virus. And honestly, I believe that we worked very hard to gain back our freedom. We had total confinement. It had a lot of impact, a major impact on society, on the mental health of young people, on the health of the elderly. You really have to help us because we can do everything that we can on our end. But if you don't collaborate with public health to give the information when they call you, nobody's going to get you in trouble, but we need to know who you were in contact with so that we can stop that chain of transmission. The curve, we have to reflatten it. We must stay in the yellow zone and go back to the green, but we can't go to orange and red. So I am begging you, please collaborate with the people from public health because whether we like it or not, it's a question of life and death or of freedom. And I think that wearing a mask, keeping a 2-meter distance and avoiding big gatherings is little compared to what will come if ever we have major outbreaks. And when there's a second wave, the first wave is nothing compared to what the second wave can be. And I'm sorry for insisting, but I really wanted to hammer the message through. Please collaborate with public health. Thank you to all of you. We are now ready to take your questions. We've got about half an hour to answer all the reporters' questions. So one question and one follow-up question will begin now. Question? I'm sorry, the microphone's not on. You say that we have to react now. I understand all that you're saying concerning parties. There was another demonstration, anti-mask demonstration last weekend. They weren't 1,000. There were 10,000 people. You've certainly heard the mayor of Montreal, Valérie Plante, saying that she's afraid. And I understand the principle of the right to demonstrate and that. But still, at home, people, there are many of them who are wondering if you will act at some point against these anti-mask people. My question is, are you going to do something with the anti-mask demonstrators? Well, first of all, we have to have a balance. And right now, I'm not excluding anything. We know that in certain countries, the demonstrations, the anti-mask demonstrations are illegal. For the time being, what we are seeing is that it's not during these demonstrations that we have transmission problems. It's in homes, in family parties, parties amongst friends. That's where we have most of the transmission. So we can evaluate the possibility. Well, first of all, we have to make sure that these people are wearing a mask when they're doing demonstrations. But in Quebec, it's important to be able to express our disapproval with the government. So if it's not detrimental to public health, well, we will tolerate it, but we are not excluding anything. On another topic, you promised the new orderlies that they will earn $49,000 a year. You repeated that on the 21st of August. You said the 15th of September is going to be $26 an hour, not negotiable. And now we are seeing that the new orderlies, they're signing agreements at $20.55 an hour. So is this another message that was not well understood either by citizens or by the network or by the unions? Because I saw in certain articles that the people who were cited were union representatives. I want to be very clear. The 10,000 new orderlies will earn $49,000 a year for the time being. In order to earn $26 an hour or $49,000 a year, we have to take into account in the short term of the premiums that we're paying them. We are in negotiations with the unions, and what we would like to see is that as quickly as possible in the collective agreement, before the premiums, these people will earn $26 an hour or $49,000 a year. But what is clear is that as of now, they will continue to earn $49,000 a year. There is part of that amount that will be a premium or a bonus, and as long as it's not in the collective agreement. What we would like to see is that the collective agreement be negotiated, that we agree with the unions to include it in the collective agreement so that we don't have to add a bonus to get to that amount. But I would like to reassure everybody, all of those who have chosen to come work as orderlies in CHSLDs, there are more than 7,000 people who have finished their training. They will all earn $49,000 a year. Question?
En clair, Monsieur Legault, ce que vous dites,
Mr. Legault, what you are saying to Quebecers, I understand
vous ne voulez pas
that you don't want
dire qu'on s'en va
to say that we're going towards confinement, but in fact, when we look at the situation, the cases that are increasing, the curve, which is no longer flattened, the number of hospitalizations that are increasing, in fact, we are going towards
partie de reconfinement.
a partial confinement. Well, we don't want to go there. Yes, but in fact, that's what's happening. No, listen, unless you've got a crystal ball. In the spring, we were at 1,000 cases a day. Now we're at close to 300 cases a day. So we're not in the same place where we were in the spring. Are we going to get to that point? We will do all that we can to not get to that point. That's why I'm telling Quebecers, be careful. We could. It's not impossible that we will get to those levels again, but we're going to do all that we can. And I'm convinced that together we can prevent going back to that level. And what about the state of preparation or the readiness? Mr. Dubé, you're saying that there's pressure in the Quebec region and the hospital settings, which are already fragile. So how can we avoid finding ourselves in the same situation that we saw in the spring, and that is a lack of material, a lack of staff in hospitals, but also in the CHSLDs, et cetera? What have you done to make sure that if, in fact, the situation worsens with greater pressure on the healthcare system, so that we do not once again find ourselves in the same situation, because now you had the time to get ready? When I submitted about a month ago the plan for the second wave, you'll remember that there were 9 axes of intervention. And each one of these axes of intervention, for example, with prevention, infection prevention and control, that were at the governance of Montreal, or with, whether we're talking about protective equipment, we worked on this, and I can tell you that we are ready. The issue where we are the most fragile is with our staff, because staff, we didn't have enough staff, and now the situation is even more fragile. I mean, it was very fragile before the pandemic. We had the pandemic, so we're even more fragile now, and we did not have the time with the union negotiations to hire all the people that we wanted to hire. We are working on that. We made nice progress with our orderlies. The Premier just mentioned this, but we still need nurses and assistant nurses. We are in negotiations with the FIC. We're moving forward, but I would tell you that when it comes to our staff, we are working on this very hard. We tried with people from Je Contribue to get additional staff. But the whole question of staffing for us is extremely delicate. And that is when I see the examples that I gave you, when we have to put additional pressure on screening to be able to do a follow-up with people, and we have to take nurses from settings, from healthcare settings, where we could catch up on our work, well, now we have to put them on cases that should not have occurred in the first place. So if you ask me what we've done, well, I can give you examples of everything that we've done over the past few months, but where we've got the most fragility or frailties with our personnel and with our staff. And they are already working very hard to be ready. But people must understand that what we are doing currently may have an impact on them, because it means that it's a parent who perhaps will have to delay their surgery. So that's what's happening. When I say that the system is fragile, it's not only because of the staff, but we've already got some delays because of what happened in the first wave. And if we continue to do the same thing and that we go up to 400, 500, 600 cases, well, there will be more people who will be in the hospital. And once again, our system will suffer. Just to add to that, what we could do, we did. We invented a training. We created a training, a 3-month training for the orderlies, and we gave it to 7,000 people. And now we are starting to train 3,000 more people. We will be okay when it comes to orderlies. Nurses, it takes 3 years to train a nurse. So the problems that we inherited a year and a half ago are still there. And it's going to take some time because even before the pandemic, we had a shortage of nurses. Question? Hello? In communication, do you have the impression that the message is no longer being heard? Well, we've got the same challenge as all the other states in the world, right? Look at what's going on in France and in many other states in the U.S. We've got a situation where people after 6 months are fed up. There are some young people who, because we had a big increase of infections with the younger population, and they're living their lives as young people. I remember when I was 20, we had parties and we wanted to meet our friends. So I understand that there is a challenge for everybody. We were in the 60 states and provinces in North America in the spring. We were the best when it came to confinement, and now we are realizing that for physical distancing and masks, we've got the same challenge as everybody else. Obviously, what we have to repeat is the consequences. Perhaps there are still some people who don't know anybody who suffered because of COVID, and that's but there are some people who still believe that they are immune, that they're invincible, that COVID will never impact them. So we have to continue to explain that it has consequences. It has consequences on vulnerable people. It has consequences on the healthcare network. It has consequences on some classrooms for the other students in a classroom. So it has consequences. And we have to continue to explain this to the population. But what we're realizing is that you put in place all sorts of measures. And if we go back to March, we're finding ourselves in the same situation. We started with 5 cases, we went up to 1,000, and now the progression is constant. So is this a failure of the measures that were put in place? I don't think so. I don't think that we can say that because, as I said, we're not at 1,000 cases, we're at 300 cases. The growth is not as quickly as it was in the spring. However, we are worried. We are worried that it may be the beginning of something. And in order for it to not be the beginning of something, we need the collaboration of all Quebecers. I think that the point, you brought it up, Mr. Laforêt, when we had the progression, and I think that Dr. Arruda and his team communicated this to us, the explosion of cases during the first wave was exponential. You'll remember that we were doubling the number of cases every day. We're not there. We are not there at all. You'll remember that we were at 100 cases a few weeks ago. We went up to 200, but it's several weeks later. The curve is still, we can still control it. We are able to control it, but it requires individual effort. In the first curve, you'll remember what we had was our CHSLDs were hit with the elderly. Unfortunately, the epidemic was really driven by that. There was very little community transmission. So what that demonstrates is that total confinement that was done stopped. What we saw in the CHSLDs could have been in the community, and that would have completely killed our healthcare system. And we would have had to make choices between people. So we avoided this. We reopened progressively. People went relatively well. The number of cases decreased. But, human nature is that people, stop respecting the measures for all sorts of reasons. And we understand it from an emotional point of view. But we can't afford this. We're still in a period of time where we could flatten that curve. I don't want to say that with the fall and the other viruses that there's not going to be a second wave. But we must truly control this phase, in my opinion, this community transmission. And that is why we must collaborate. That's why the public health teams can still intervene with cases and contacts. But if we lose control, well, obviously, we're going to have stronger interventions that would be progressive, that would be more surgical. But please, don't bring us to the orange level or the red level everywhere. Obviously, we're going to have some orange soon, but that's why the measures that we will put in place, and if you'll allow me, we tried quite a bit to convince, and I think that we have to continue to convince people who perhaps who have loosened the restrictions, but we won't hesitate to put in place some constraints, because I'm sorry, it is the life and the economy of a people that once again could be impacted, and we don't want to see that. Question? Mr. Premier, at the end of August, we were saying that all of the people who are going to be tested could have a result in a delay of 24 to 48 hours, whether it was people who got a positive or negative result. Now, there are several testimonies in a few regions where clearly we go beyond that delay. It takes several days to get results, which has consequences on the economy, workers who can't go back to work, children who aren't going to school. How is it that we cannot have a system that provides results quickly? And why, from one region to the other, the way that we communicate with people, it varies. Sometimes it's, texts or calls or... So what are you going to do to fix this problem? You'll remember that for a long time, we were doing 6,000 tests a day, and our objective was to go to 14,000 tests a day. And it was difficult. It took us a while to get to the 14,000. Now we are at 26,000 tests a day. And what has changed since August is a number of regions. If I take the example of the Outaouais region, in August, I don't remember having big problems in the Outaouais region. Now we have to install screening clinics in the Outaouais region because there are more cases. The same thing in the Lower St. Lawrence. The same thing in 8 regions. So it's no longer just Montreal. So we have to deploy these clinics, and now we have to understand 20 or 26,000 tests a day per million inhabitants, and out of all the provinces, we're the ones who test the most, first of all. Second of all, there's a contact tracing following the tests. Now, at Public Health, we've added a lot of employees who do the contact tracing. So we have to organize all of this in the 8 regions that are yellow now. I don't want to take the pressure off of my friend Christian, but I'm confident that he will get to that point in all the regions. Do you want to add anything, Christian? Thank you for your confidence, but I am not happier than I was a few weeks ago when we spoke, for several reasons. All the reasons that the Premier has just explained. We've got a team that is working on this, but I'll give you 2 elements. You talked about standardization, and you are correct. We have limitations, legal limitations, and we are clarifying this now, where certain CIUSs or CIUS decided to answer by email or by text, whereas when we communicate results, we should do it individually. But now what we've asked is when people register for their tests, they will accept that we contact them in this way. And this may seem like nothing, but this method will allow us. I've got some nurses. I was given examples over the past few weeks. There are nurses who who had to call 3 to 4 times to give the same result. But in the meantime, these nurses are not doing anything else, and we had to remove them because we had more calls. So you're right. And now we said, how come it works for that CIUS that decided to take that approach? So this standardization will occur. There are other elements as well. If you'll allow me, Mr. Chouinard, we've ordered a lot of equipment, lab equipment, but there are many of our neighbors who have done the same thing. There are some testing devices that are coming in, they're arriving, and some will be commissioned. So there's all sorts of reasons. And the last, I talked to you about a platform, an electronic platform that we are developing, but it's not for next week. It takes a few weeks. But we will be able to integrate our entire process in that platform. You won't like my answer, but it's worth it to wait a couple of weeks because we will test people in a few weeks still. So to answer your question, we are working on it, and I'm very proud that we have gone from 12,000 tests in July to 20,000 tests this week. But I'm asking people to understand that we're doing all that we can. I saw the waiting lines that there were in Ontario yesterday in the Ottawa region. Everybody's going through the same process. It doesn't excuse the fact, but I think that we must ask people to support us in this process because what we want is to give results as quickly as possible. Thank you. Mr. Premier, I'd like to hear what you have to say about the practices that have started since the beginning of the pandemic. So the hiring of workers who are paid in the black market or under the table, immigrants often who work illegally in our establishments and the CHSLDs for subcontractors to do the cleaning. So first of all, do you consider that the establishments and CIS are at fault here? And secondly, are there measures to end this practice? Well, first of all, it's unacceptable. Secondly, I've asked a question. What I was explained, and we're finalizing the investigations, but these are not CIS or CIUSs that did business with these people under the table. These are establishments that did business with companies who themselves did business with other companies. So there are like two middlemen. But even if there are two middlemen, it's unacceptable. And now we're investigating to make sure that this does not occur again. We're running out of time, and now we'll go to the next question. Hello. You said that some zones are very close to being orange. Can you tell us concretely which zones they are? And may they be orange by the end of the week? I don't want to answer that question because I hope that the situation will change. But yes, there are a few regions. I don't know if these codes are based on the epidemiology, on the types of outbreaks, on the capacity to do investigations. It's based on what impact it has on the healthcare system. And we've got a meeting every night with the directors of public health to evaluate all of this because we've got data centrally. But there are some people, the public health directors know what's going on in the field. So I don't want to announce anything because it could have negative effects. When we will have decided that we move forward, you will be informed as quickly as possible. Our minister and the premier are informed of the situation. But also we have to understand that things are dynamic, right? We could see either an increase above 300 everywhere, or we could have a region which controlled its outbreaks. So in that context, we do an analysis, not just of the numbers, but of the situations that are occurring. And that is where we will also see, well, before we even go to the next level, can we take measures from orange and apply to the yellow without everybody going into the orange? That's possible because it depends on the profile or what we're seeing in the outbreaks. We are adapting that tool, which is a good lab test, but then afterwards, it's like a lab test, right? The doctor has to look at a specific situation and say, in my region, compared to Montreal, this is what's happening. So we do this every night, and what we're providing you now is the analysis that we did yesterday. What I would add is that I said last week that we would provide an update every week, you'll remember. And I think that the situation over the next few weeks will perhaps justify that we have this type of announcement more frequently. So to answer your question, if over the next few days we think that it would be good to give an update for certain regions, we're not going to wait until next Tuesday. Do you evaluate the possibility of doing sub-regions? Because there are some regions that are big, and there are citizens that could say, well, in my sector of my region, it's not true that the epidemic is as strong as in the downtown core. We have asked, thank you for the question, I had said that there would be a concept of sub-regions. Obviously, currently, we are looking at the region as a whole, because when we are in yellow, the events or the impact on the citizen is not as great. We're talking about inspections, that kind of stuff. But if we go to orange or red, well, obviously, it's got a much greater impact. So what we are doing, and we've got the information to do so, we analyze what is the impact in certain regions. And I don't have the expression doesn't come to mind, but what we call the heat maps, right? So now we have all the information to work. We've now have the tools to look at it by sub-region. So if we had to go further than yellow in certain regions, well, obviously, we will be able to look at how a sub-region is affected versus another, because we understand the problems. For Mr. Dubé, The indicators show that emergency departments are at their limit currently in the healthcare network. Can you explain what's going on in the emergency departments? Well, in the emergencies, it's a phenomenon where you'll remember that during the first wave, the emergencies, or the traffic in the emergencies decreased quite a bit because people did not want to leave the house. And we found ourselves with emergency departments that were barely used, which we hadn't seen in years. But now, with the nice weather, well, people are going back to the emergency department. And if there are some worries, whether it's with the coronavirus or regardless of the concerns, people have gone back to the emergency departments, particularly in certain regions. You know that the emergencies are part of a very clear mandate that I've received from the Premier. I've created a working group with Mrs. Savoy. We've identified the main emergency departments in the Greater Montreal region, more specifically, and on which we will be working. We've already started to act in a concrete manner, because it's never just one solution. It's never just one thing that's going to solve a problem in an emergency department. It's several factors. Sometimes it's the governance. Do we have enough beds? Can we add modular units? You saw the example that I gave you at Lakeshore in the West Island. We've added some infrastructures. So we are working on this, but it's all sorts of elements. You will know that there was an article published this week, and they were talking about the IPS and how our specialized nurses can now work on triage. Well, we have to give them the right to not be limited to certain functions. So there's all sorts of reasons, all sorts of factors on which we are working. But once again, it's going to take a bit of time. But we are trying to move as quickly as possible, and it's a priority for our CEOs. And we are having a meeting tomorrow to see how the emergency departments that we've identified, how we can improve them over the next few weeks. Mr. Premier, earlier you talked about young people who are living their youthful lives, but are there groups of populations that are more targeted or more impacted by the transmission of the virus? Well, it's young adults who represent the greatest number of cases. But I want to tell you, and I don't want to ostracize one group or another, but the behaviors, we can observe them with, older adults and younger adults. So people in their 40s and 50s, who have barbecues or people who have parties. So actually, the deaths are still, unfortunately, with the elderly. We saw that the 5 recent deaths were in RPAs and CHSLDs. But the effect of community transmission will penetrate these environments. Either it's a healthcare worker or a visitor or whatever will bring the virus in, and that's why we have to protect them. Just to give you some stats, we look at this every week, and I'll give you the stats from the 5th of September, and I don't have the ones for the 12th. But for the week that ended the 5th of September, the portion that Dr. Horacio was talking about, which is the most significant to me, is 20 to 29 years of age. That's 21%. But 30 to 49 is 29%. So when you add the 20 to 29 and 30 to 49, that's 50% of the cases. So when we say that that's where things are happening, we're not in CHSLDs here. Does that answer your question? And this table is updated every week. And I hope that we will be able to work on that population more. So these are active young people who can have 2 jobs. They may be students in CEGEPs, and at the same time they work in a drugstore or in a convenience store. So you can see, and they have parties. So you can see the potential, which will eventually impact vulnerable people.
Oui, bonjour, messieurs. J'aimerais avoir un regard rapide sur la région.
I'd like to hear you on the metropolitan region. We know that there are other regions that are in the yellow, but Montreal was particularly impacted during the first wave. So I'd like to hear, what is your point of view on this region? Montreal is always, we have to We have to be careful. It's a different kind of beast, right? Because there's Montreal and there's all the regions, the neighboring regions, which are very close, connected by bridges, et cetera. To date, I would tell you that Montreal has behaved well. Actually, it was the last region to go into the yellow zone, so I think that that's good news. And one of the reasons for this is that people had a really hard time with the first wave, and people were much more alert and vigilant to the measures that were put in place. When we talk about the hygiene measures, you know, the Premier gave an example. It's much easier to convince somebody who's lost a loved one in an RPA or in a CHSLD, and that's what Montreal experienced. And what we are seeing, and that doesn't mean that we're out of the woods in Montreal, that's not what I'm saying at all, but we are seeing that unfortunately, and I saw this in the cases in the past few days, you can see the increase of cases. We publish it every day now. In Montreal, it's increased, and that is community transmission. We are not where we were in the spring with the CHSLDs, and what we're worried about, and I'm repeating myself, we have a lot of nursing homes and RPAs, and that's where the community transmission may go into, and that's what we have to be careful with in Montreal, like elsewhere in Quebec, but particularly in Montreal or in cities where there are several nursing homes or RPAs, and that is why we have put them in the yellow zone, because we had several of these cases this week. Mr. Premier, you mentioned that there might be closings of businesses. If that happened, have you already made the decision to perhaps free up some funds or to help businesses directly or help restaurants directly? Well, Investissement Québec for amounts of more than $50,000 and the CLDs for amounts of less than $50,000, we are continuing to advance money to businesses that need liquidity to get through the difficult times, so that until all the activities resume. Obviously, if there was a situation such as this one, yes, we will help them. Mr. Dubé, please talk to me about Quebec. Now, Quebec seems to be worrying you. Well, I would say that what I think, what I've explained, and I talked about this with Mr. Labaume, everybody's concerned by what's happening in Quebec, not just me. It's not a personal issue. Our entire government is preoccupied by this. And I'm repeating myself. I would be very happy if over the next few weeks these regions, like the national capital, went back to green. And it's a question of individual responsibility. Look at what brought us to that point. And I will say this, there's the karaoke bar, right? Can we put that behind us, please, and make sure that the outbreak is controlled and that we can come back to green in Quebec? I would be very pleased for our schools, for our healthcare workers. I think that everybody understands that we can make a difference over the next few weeks. You said earlier, Mr. Arruda, that the second wave could be much worse than the first wave. The impression that you have is that the consequences could be even greater than in the spring. Listen, I'm not God, and I don't have the intention of pronouncing myself like that, and forecasting is never easy. But we understand that generally, when there are epidemics with the new virus, the first wave is usually much smaller than the second, a proportion of about 3 times. But that's if we do no interventions. That's in a context where we don't do any isolation and no interventions. So we don't want to have 3 times more cases. But if we let things go, if everybody just lets our guard down, well, we're giving the virus a possibility of multiplying, and it will take advantage of that. Very quickly in English.
Good day to you all. Premier, I would like to ask you, for 2 weeks, can you hear me?
Yeah.
Sorry. For 2 weeks, you've been asking people to follow the rules, and we see again today the cases keep growing. There are more. 75% of the population is now in a yellow zone. What's your next move to control this?
But as you know, there are different measures that are planned to be put in place when you go into the orange zone and the red zone. about closing bars or about reducing the maximum of 10 to 6 people, et cetera, et cetera. So we're not there yet, but we're getting closer, unfortunately.
And for Mr. Dubé, you were just saying that the biggest problem is staffing. It says, the ministry says you got 7,100 orderlies. You wanted 10,000. Are you actually going to hit 10,000? And what would be the shortage? You also mentioned, what shortage is there for nursing and nursing assistants?
Okay, well, two things. We're going to get the 10,000 because there is a second group that is already started that will be coming in the next few months. So the target of 10 is still there, and we'll get it. Now, on the nurses, as you know, as the Prime Minister explained, the training and the formation is much longer than the préposé aux bénéficiaires, so we need to find other alternatives. But I think with the negotiation that is taking place right now with la FIC, la Fédération des infirmières, I think we'll find solution over the next weeks. But our goal is to make sure that we settle the collective agreement with them in the next few weeks. That's very important for us.
On me dit qu'il reste du temps pour une seule dernière question, mes excuses aux collègues anglophones. Raquel Fletcher, Global News.
Une seule question. Yeah, can we each have one?
Rapidly.
Okay. Mr. Legault, earlier today, just before this press conference, your education minister held a presser as well, and he was unable to answer some pretty pressing questions about the plan in education. There was a question about ventilation in the schools. There was another question about a massive testing that was going on in one school that he seemed unaware of. Do you still have confidence in your education minister?
Totally.
And no concerns about his inability to answer?
Not at all. The plan is well done, yeah.
Kelly Craig?
For the 75% that are now in the yellow zone, that's 6.3 million Quebecers, it seems like the messaging has changed from you can have private parties, but keep them small, be careful, subtly has changed to best to avoid private parties. I'd like to talk about that messaging and also how frustrating it is to have people ignore it and kind of the ramifications of that.
Well, of course, as you can imagine, it's not easy to have any kind of intervention in housing with the police giving penalties. It's not easy. So it's a very big challenge. So that's why I'm asking each Quebecer to be responsible, to try to limit the number of people in gatherings, and when you do so, to be careful, to keep your distances and wear a mask.
This is 6.3 million Quebecers right now.
Yeah.
Très rapidement, Cathy Sonnet, en terminant.
I would like to hear you about Montreal. You spoke about Montreal in French. What's at stake right now in Montreal? What was different in the spring and now what you see with community transmission?
When we look at the figures per 100,000 people living in a region, Montreal is doing better than many other regions. And we think that the reason for that is that people, they know what happened last spring, so they are more careful. They don't want to see that again. So maybe it's the explanation, but we don't have the exact explanation, but we can see that per 100,000 residents, it's going better in Montreal than in some other regions.
Merci tout le monde.
Merci tout le monde.
Thank you, everybody.